Thank you to the NCCEH for inviting me to speak briefly about the work that's being done at Health Canada on extreme heat. Um, as I mentioned before, so my name is Melissa Gorman. I'm the Senior Heat Action Lead for the Heat Action Team within the Climate Change and Health Office at Health Canada. My primary role is to support the provinces and territories with developing heat alert response systems. And I am speaking today from Edmonton, which is located in Treaty 6 territory, traditional land of various Indigenous peoples, including the Cree, Dene, Anishinaabe, Dene, Nakota, and others. And so I'll just jump into the next slide. Our mission within Health Canada broadly on heat is to protect the health of people living in Canada from extreme heat. And we do this through a number of ways. We support our health partners with developing and improving heat responses across Canada, especially through the development of heat alert response systems. We also aim to increase public awareness about the impacts of extreme heat and measures that people can take before, during, and after an extreme heat event. We are also advancing science to assess the risks of extreme heat to people living in Canada from extreme heat, especially those who are at greater risk. We also work in collaboration with Environment and Climate Change Canada and our provincial and territorial health partners in developing health evidence-based heat warnings, as well as the heat health messages that are shared with the public. We also work with partners to fill evidence gaps and advance action to protect health from indoor heat and support emergency preparedness measures for potential heat emergencies in Canada. And lastly, we provide funding opportunities through our climate change and health capacity building program called Heat Adapt, which specifically focuses on protecting people living in Canada from extreme heat. So I'm just going to move to the next slide. It will cooperate. There you go. We all know that extreme heat events are increasing in intensity, duration, and frequency due to climate change and resulting in illness and death. But really, the good news is that we do know that heat-related illness and death is preventable. And one of the ways that we do this is through the work of heat alert and response systems, which we commonly refer to as HARS, so the acronym of HARS. Heat alert response systems, or HARS, are systems that allow regions and communities to prepare for and respond to extreme heat events. And so these systems alert the public about the risks of extreme heat, direct and coordinate community response, and protect the public by providing information about actions that they can take during an extreme heat event. HARS can be tailored to regional and community needs and resources, but in general, we do see that there's 5 recommended components recommended within Health Canada's guidance on developing HARS, which I'll briefly describe. A community mobilization and engagement phase, the first one there, is to determine community needs, assign a lead coordinating agency, and identify key interest holders to carry out a response. The alert protocol, number 2, identifies heat health risks and vulnerabilities and outlines criteria to activate and deactivate those plans. Third is the communication plan, a very important step that outlines heat messaging, delivers education about adaptation, connects partners, and alerts the public and interest holders to extreme heat risks and what they can do. The fourth one is the community response plan, which mobilizes partners and assists vulnerable or at-risk populations. And lastly, there's the evaluation plan that assesses the functioning and impact of heat response measures and identifies opportunities for improvement for future heat events. There are a number of stakeholders that can have a key role to play when it comes to reducing the health risks from extreme heat, including pharmacists, primary and community care professionals, organizations, and others that serve specific population groups that are at greater risk, and others. I wanted to share some of the technical resources that we have available on the Health Canada website, targeted to health professionals and public health practitioners. There is guidance on the development of HARS, so that first link there, as well as some technical guides for healthcare workers in acute care, retirement and care facilities, community care. We also have guidance for pharmacists and emergency management officials. And again, they're all online on our website, virtually online as well as in print if you request them. I also want to highlight that there are a number of heat health communication materials that are available to the public that are also available in print or online on our website. In particular, there are fact sheets and infographics describing protective measures that can be taken for older adults, children, people working or exercising in heat. There's also a one-pager at the bottom here that refers to the 3 steps that people can take. For example, being informed, getting hydrated, staying cool. And lastly, last year we developed guidance in collaboration with our colleagues at the Air Quality Bureau in Health Canada to develop some guidance on situations where people are experiencing concurrent wildfire smoke and heat exposure. So that's all online as well. I also wanted to plug Health Canada's Heat Community of Practice, which is a forum for public health professionals to share best practices. We host a number of virtual webinars each year. There's an online portal where people can post news and information with others. We also have a mailing list to share new publications and upcoming webinars. So if anyone is interested in joining our Heat Community of Practice, I'd encourage you to email us directly through the email on this slide or contact me directly. And then lastly, before we hand it over, I hand it over to Rebecca to speak to the report and the work that's been done by the NCCEH. I wanted to provide a little bit of context about why this project came about. Health Canada funded the National Collaborating Centre for Environmental Health in gathering an initial inventory of heat adaptation interventions implemented by health authorities and provincial and territorial governments. We really saw this as a first signal check of heat action across the country. And through this work, we're really hoping to understand the gaps and challenges of heat action across Canada, uncover best practices that people are taking that we can share with our heat community practice, and also to help shape and guide our future heat-related program and policy development within Health Canada. So just wanted to say thank you to Rebecca and Elizabeth and others and the NCCEH for all the hard work over the past year in doing this report and creating this amazing product for us. And just really excited to have Rebecca share the results with you all today. And that is it. Over to you, Rebecca. Thanks.
Thanks and welcome everyone for joining us today. It was a great intro to the project, Melissa. Today I'm going to be sharing our findings from the recent report on heat alert and response systems, or HARS, across Canada that we conducted. It was a stock take to understand more about how prepared Canadian communities are for extreme heat. I want to begin by acknowledging that I live, work, and present today as a white settler and uninvited guest on the ancestral and unceded Coast Salish lands of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh, who have cared for these lands for countless generations. As I speak today, I reflect on what it means to live and work on these lands with respect, reciprocity, and accountability, and recognize the responsibilities that come with being on this land. And I'm committed to ongoing learning and respectful relationship building. We'd like to acknowledge funding and support by Health Canada, as Melissa said. The views expressed herein do not necessarily represent the views of Health Canada. We'd also like to thank all of the participants for their time and thoughtful contributions during the interviews, which informed this review. We acknowledge the valued input of this work from Elizabeth Loftus, Barb Carlin, Jeremy Boudreau, who assisted conducting interviews, and Dr. Juliette O'Keefe and Dr. Sarah Henderson, who provide senior guidance and review of outputs of this project. So just as an outline, I'll just be going over why extreme heat preparedness matters. Not that I think I have to convince a lot of you on the call, but we'll also run through a little bit more about heat alert and response systems, and then the findings of the review, and then followed by some questions and answers. First of all, I would really like to hear who is on the call. So I'm just going to start a Slido. Hopefully it will work. If anyone is participating. It's taking a bit of time. It might be a bandwidth thing. Okay, we've one academic institute. Oh, we've got more people coming in. That's great. Okay, so just leave it a couple more minutes, or actually I should say seconds. But yeah, it was great to see. Obviously, we're expecting to see a lot of health authorities, public health units participating. Academic institutions, great. Federal government, thank you. Local municipal government, thank you. Indigenous governments, thank you. And others and community partners, that's great. Okay, I will move on. Okay, so We know climate change caused by greenhouse gas emissions from the burning of fossil fuels and other sources is increasing the frequency and severity of extreme heat events. As emergencies go, extreme heat is usually under-recognized compared to other emergencies, but this is changing as these events become more common. Extreme heat is one of our deadliest climate-related health risks. In 2021, as you all know, an extreme heat event, also known as the heat dome in BC, caused 619 deaths. And the death panel review in 2022 reported that almost all these deaths were due to indoor heat. Indoor heat is often called a silent killer because it can happen in private spaces, out of sight, and the public and media don't always treat it like an emergency. We know we need to prioritize the health of those most at risk from extreme heat. And while everyone without access to safe temperatures in their homes, communities, or their work are at increased risk, or in school or daycare, based on what we know from the heat dome in 2021, these are the groups of people who are at increased risk of having health-related illnesses during extreme heat. Older adults, people with mental illness, people with chronic diseases, people living alone, people who have substance dependence or use substances, people who with impaired or decreased mobility, people using certain medications, or people with poor physical fitness. And these groups of people need to be given special attention and protection. So why does extreme preparedness heat matter? Well, heat can be deadly, and the heat impacts are often widespread and not localized and can overwhelm emergency services during the event. And the risk of exposure is increasing. Preparedness, we know, as Melissa pointed out, we can prevent heat-related illnesses, and preparedness reduces harm and also builds resilience. In Canada, alerts for weather events, including extreme heat, are issued by HCCEH. Alerts, Environment and Climate Change Canada, alerts are used to generate awareness of current, imminent, or forecasted events, and all heat alerts issued from HCCEH are in the form of heat warnings, and are issued in advance or during that period of heat. So the criteria that HCCEH use to issue heat warnings are established in coordination with Health Canada and provincial and territorial health authorities, and vary across the country, and are generally when specific temperature humidex thresholds are forecast to be met or exceeded for at least 2 days, but it's region dependent. And then obviously heat warnings trigger public health responses, such as opening cooling centers and issuing public guidance. So with respect to what an extreme heat event is, there is no standard definition of an extreme heat event, but in general, a general description is it's a prolonged period of unusually high temperatures combined with humidity. The World Meteorological Organization defines a heat wave as a period where local excess heat accumulates over a sequence of unusual hot days and nights. In extreme heat event, daytime highs and nighttime lows exceed thresholds and are often well above the historical average of a given location. The impacts are broader, with the event posing serious health and environmental and infrastructure risks, complicated by compound events like wildfires and power outages. So Health Canada produced a guidebook, as Melissa pointed out, of best practices for HARS, and in it they describe a heat alert and response system as a comprehensive, coordinated adaptation approach to protect public health during periods of heat, in particular extreme heat events. So HARS involves public health and emergency management officials, community health and social service providers, and other partners, as Melissa pointed out. All partners work together to prepare for and to respond to dangerous heat, with a common goal to reduce health risks associated with extreme heat, particularly for susceptible people. I won't go over in detail these core elements because Melissa really nicely laid those out. But just to say that HARS integrates meteorological data with public health action and involves agencies across sectors, and is defined by these 5 core elements. The organizations involved, so we have the elements, but who is involved and who does what, which is actually has come up in our stock take as a theme to try to understand. Effective HARS requires clear roles, regular coordination, and timely information sharing across all these levels to protect the most at-risk populations during extreme heat events. So the federal government, Health Canada, which provides national guidance, scientific evidence, risk communication resources, etc., etc. ECCC, which issues heat warnings and weather forecasts, etc. Other departments as needed, particularly when overlapping hazards are involved. Provincial and territorial governments, ministries of health, public health units, health authorities can provide regional leadership on developing and implementing HARS, aligning alerts with public health measures and supporting municipalities. Emergency management offices can be involved. And also housing and infrastructure and social services. Indigenous governance for First Nations, Inuit and Métis leadership can plan and deliver heat responses that reflect Indigenous knowledge, governance and community-specific needs, often in partnership with federal and provincial or municipal partners. And municipal, local governments and community partners can lead the implementation of HARS, activate communication and response protocols, or coordinate local service providers or emergency services. Fire, police, and municipal emergency medical services can conduct wellness checks, support evacuations, and respond to heat-related emergencies, and so on. So, I obviously want to point out the important role of community partners, nonprofit, and also faith-based organizations. So how this maps onto the core components is not a simple task, but just generally pointing out that all partners are usually involved in community mobilization and engagement. The alert protocol is often a federal and provincial coordination, but also involving other partners at the local, municipal, and Indigenous levels. Communication plan is usually a little more downstream in terms of communicating about the impacts of heat may have on health. The community response plan is again more related to local, municipal, and community partner work. And then the evaluation plan usually involves everyone evaluating their own activities to facilitate improvements. And so while HARS is focused on alert and response, we must remember that preventative action is essential to lessen the threat from extreme heat. And there are many things that we can do for long-term and sustainable protection. But I'm going to actually jump to exactly what we did to evaluate HARS. So given the increased likelihood of future-driven climate change-driven extreme heat events in Canada, a detailed understanding of HARS implementation is needed, as Melissa laid out the rationale for this project. So to achieve this, we did this pan-Canadian stocktake to gauge the implementation of HARS by provincial and territorial governments and regional health authorities. And we had some key questions like what HARS or HARS plans are in place currently, and also what challenges and barriers exist to developing, improving, or implementing, and what opportunities exist or solutions that might help address the challenges for HARS. In Canada, health services are primarily delivered by provincial and territorial health authorities, which oversee hospitals, public health, and community care. Most provinces, such as Alberta and Saskatchewan, use a single province-wide health authority, where others like British Columbia, Manitoba, Quebec have regional health authorities that serve specific geographic areas. Ontario is different. Public health in Ontario is delivered by 34 local public health units. With amalgamation, this is now 29, many of which are integrated into municipal governments or autonomous regional entities governed by boards of health. And so when looking at HARS, obviously that really affects the context of how plans might be developed or implemented. So to carry out the review, we conducted searches to identify HARS and extreme heat preparedness information on websites from regional health authorities and provincial territorial government websites. We didn't search municipal government websites, nor we didn't document actions either from those websites during the web search. We We surveyed and interviewed key informants at health authorities, public health units, and provincial territorial governments across Canada in 2024. We analyzed responses in aggregate and reported them anonymously, and we identified common themes across interviews. There are also lots of other minor themes that arose that are not discussed here. And overall, considering the survey and interview participation, we had participation from across the country except for Prince Edward Island and Nunavut. So, while some plans may not be specifically called HARS, these will be referred to as HARS plans because if they contain HARS recommended core component activities. So we identified 6 provincial level HARS plans in the search: BC HARS, Manitoba HARS, Ontario Harmonized Heat Warning and Information System, HWIS, the Québec Plan Ministériel de Gestion des Épisodes de Chaleur Extrême, Nova Scotia HARS, and New Brunswick HARS. These plans all differ quite a lot, but I just thought it'd be worth just jumping into BC HARS. Doing a quick zoom in because it's the best example of a provincial territorial level HARS given its level of detail and coordination. And we didn't review in great detail the HARS plans that the 6 HARS plans. We do provide a summary of them in the report and links to them in the report. But just to give a background on BC HARS, so the BC Health Effects of Anomalous Temperatures, or BC Heat Coordinating Committee, was founded in 2022 following the devastating heat dome in BC, and its initial priorities were to develop consistent public health messaging and actions for provincial heat alert system, defining heat alert criteria, and recommending preparedness and response measures. The BC Heat Committee is led by the BC Centre for Disease Control and the BC Ministry of Health, and includes participation from these other organizations. And also just to point out here that the Union of BC Municipalities is represented. The BC Heat priorities led to the development and launch of a provincial 2-tier heat alert and response system in June 22, aligned with HCCEH forecasts. So there's a heat warning which is issued when temperatures exceed threshold values over multiple days, and an extreme heat emergency issued when there's sustained high heat and a little overnight relief with increased risk to population health. The BC HARS document is a framework and it emphasizes clear, actionable public messaging during heat events, the use of pre-approved templates and multilingual materials, and collaboration with media, social service providers, and community groups to reach high-risk populations. And to help with that, the document has a series of tables of key messages and recommended actions for different partners, as well as guidance for regional health authorities to develop their own heat plans. And this includes tables for public health, hospitals, local government, and community partners. Searches of regional health authority websites also reveal publicly available HARS plans, but only in Quebec and Ontario. In Ontario, 7 of the 34 health authorities mentioned a HARS or a similar system, but only 2 provided documents on their website. And in Quebec, 4 of the health authorities explicitly named and shared their regional heat response plans, while 3 referenced a plan without providing documentation. So these are all provided in the report with a bit of a description. And while the web search focused on HARS, it also captured information on website resources that feature extreme heat messaging and tools. These included messaging and infographic resources for specific high-risk population groups and general population on how to be prepared and stay safe during extreme heat events. There were also additional toolkit resources for municipalities and communities to assist with their development of their own heat plans. We conducted a pilot survey in Ontario in April to May 2024 and a pan-Canadian survey in October, November 2024 that had some additional questions for the remaining provinces and territories. We sent out an overall 375 survey invitations, but in total we received 66, 56 in English, 10 in French, following which we conducted some informant interviews. So yeah, so we in total, I already said that, sorry. Okay, so the types of questions we asked in the survey were things like, do you have HARS plans? What core components are covered by your HARS plans, and what kinds of activities you carry out during extreme heat? So when surveyed about HARS plans, about 70% of respondents reported that their organizations had existing HARS plans, and that represents 38 health authorities, emergency management organizations, and provincial and territorial governments. And, you know, there's a bit of a caveat here, because while there are a few publicly available health authority level HARS plans identified through the web search, we found that some survey respondents and key informants stated that their organization had internal plans and other less formalized documents in the surveys and interviews. So when we asked these 38 health authorities how many of the core components of HARS were incorporated in their HARS plans, we see that, you know, over the majority actually have a lot covered in their plans, with the exception of the evaluation. And we weren't really surprised to see that communication was covered, and also the alert protocol, and maybe less so the community response plan and the pre-heat season activities. Okay, so participants of Pan-Canadian survey were asked to select the types of activities conducted or being developed by their organization. And these were for respondents saying that they were either developing or actually already had HARS plans. So we saw various things, but over 50%, this is numbers of respondents here. So over 50% were doing things like sending preseason emails, building relationships, hosting preseason meetings, etc. Doing work to identify populations at risk in the preseason period. And then for the alert protocol, again, over half were doing activities like trigger alerts, identifying the alert trigger based on weather conditions, receiving alerts and distributing them by email distribution lists, encouraging all municipals partners to do the same, and then also distributing the alerts via media releases, radio, social media, etc. For community response plan, you know, over half of the respondents pointed to advising municipal and community partners to do targeted outreach and also to open cooling centers. And then for communication, again, there was a lot of respondents who, over half, over 3/4, who responded, saying that they use media releases, radio and social media to raise awareness, use websites, they communicate impacts of heat to municipalities and community partners, and also to healthcare providers. Evaluation plan was the least sort of well responded in terms of the activities are concerned. So, you know, only 1/4 have been looking at their evaluation plan to evaluate a past event or evaluating multiple municipal and community partner experience. So we conducted, following the surveys, we identified key informants that were interested in doing interviews. So we identified 36 key informants. 33 of these were in interviews were we did 36 informant interviews with 45 individuals from health authorities, emergency management organizations, and provincial and territorial governments. The interviews were semi-structured, with an interview guide that gain further insights on the challenges, barriers, and potential opportunities. And common themes related to HARS core components arising across these interviews were identified. And I just wanted to say at this point that we really want to recognize all of the good work being done on HARS, and that we learned about through the web searches, surveys, and through the interviews. We want to acknowledge all these ongoing efforts. This presentation focuses on key challenges and opportunities, but we definitely don't want to miss the opportunity to recognize that. So from our interviews, I'm just realizing I am not keeping an eye on the chat, so we will get to that when in about 10 minutes, I think, or so, maybe 15. But from our interviews, it was clear that capacity and funding are considered to be critical barriers. And these challenges, they impact all aspects of HARS, like pre-season engagement or identifying at-risk populations, communication tool development, cooling center operations, post-evaluation. Key informants highlighted that many municipalities lack sufficient capacity, and this is especially due to limited staff and resources, high staff turnover, shifting priorities or portfolios. And this is also true for health authorities as well. Indigenous, rural, and remote communities face the greatest difficulties, and due to disproportionate climate impacts, overlapping emergencies, floods, fires, and heat, back to back. Limited infrastructure, so few cooling spaces available. We learned that there are a lack of clear mandates and role definitions between health authorities and local governments, and this has hindered HARS planning and response, leading to confusion over responsibilities, such as who should cancel outdoor activities during heat warnings, for example. This quote captures some of this. Trying to delineate what all these different programs and plans are and to what level and who's leading them has been a bit of a challenge as we navigate forward, and trying to communicate that up through the political policy process as well. We heard that there was a lack of data and a lack of understanding about who and where at-risk populations were, which is thought to limit communication and effective community response during heat events. There was a call for HARS plan templates, standards, and guidance, cascading and compound hazards such as extreme heat combined with wildfires, smoke, exposure, or power outages are increasingly complicating HARS planning. Oops, sorry, went ahead to there. And this is actually especially true in remote communities. So key informants said there was a need for detailed and context-specific guidance to help manage overlapping emergencies and improve readiness for complex climate-driven events, standardized and adaptable templates, and stronger knowledge sharing via communities of practice, like the one was just pointed out, Melissa pointed out, were identified as, a key solution to improve local HARS planning and response. This quote really captures the concern about templates. Local governments and nonprofits like things that are just for them. They don't like to having to comb through what's for them versus what's not. Key informants also raised that misalignment between ECCC heat warnings and thresholds and health risks can create challenges in timely and appropriate alerting. They experienced some difficulties issuing alerts after hours and communicating clearly with existing terminology provided. Also, solutions. Key informants call for earlier, clearer and more impact-based alerts to provide support to better support proactive response planning. During the interviews, key informants raised that there is generally a concern that heat warning messages aren't reaching susceptible populations, including seniors living alone, non-digital users, and those with language barriers. Complex terminology and unclear alert thresholds hinder understanding. Message fatigue also further complicates communication. And so for solutions, suggestions included improving online resource accessibility, using more printed materials, creating pre-approved messages, and increasing capacity for translated, simplified, and targeted communications. With respect to community response, challenges related to community centers, cooling centers, I should say, or spaces, emerged as a prominent theme, particularly based on experiences shared with key informants by municipal partners. While cooling centers are seen as valuable resource in a community, many lack mobility to access cooling centers or choose just not to attend them. Remote areas frequently lack the infrastructure to offer cooling centers to the public. And a recurring issue raised by key informants was the difficulty in staffing these centers, especially on the weekends. Additionally, the rigid approach of funding cooling centers, in which funding is contingent on active heat warnings, can lead to a problematic yo-yo, activation and deactivation and reactivation. So to address these challenges, key informants suggested that normalizing the use of publicly accessible spaces such as libraries, community centers, faith-based buildings, malls, and other community spaces as alternative cooling spaces. This approach could help mitigate some of the operational attendance issues. But the use of publicly accessible infrastructure as cooling space already a strategy of urban municipalities in Canada, Vancouver, Toronto, Montreal, but this approach is not a viable strategy in remote regions and smaller communities, which may not have shopping centers or libraries, and where gathering places may be in older buildings with inadequate cooling or ventilation and air conditioning systems, or any air conditioning at all. And this encapsulates that exact concern in a remote community of 1,000 or less. You don't have a library, you don't have a shopping center, you don't have any other private space or public space which can be used as a cooling center. Informants emphasize that ensuring safety at home during extreme heat events is critically important, but often overlooked. Most people prefer to stay at home during heat events, highlighting the need to adapt homes to maintain safe indoor temperatures. So one solution is to conduct heat-related check-ins and foster social connections that are important for supporting people's safety at home during these events. Key mitigation strategies also include implementing maximum temperature bylaws for rental properties. That was raised during our interviews, promoting cooling retrofitting initiatives for existing buildings, and expanding passive cooling measures in home design and renovation. This is a very important quote. I felt like our homes are where we find safety. Our homes are a prerequisite for health. Our homes are a place for recovering from health issues. Our homes are what we need to be climate safety zones. The way we've thought about equity in terms of climate safety is to make public spaces climate friendly. And I think what we've learned is that public spaces aren't where people go for safety. I think people do go to centers for safety, but I think this is just such an important quote to emphasize the importance of our homes. Evaluation challenges. So evaluation can mean many things, of course, and there are current limitations. What can be evaluated according to key informants, partner experience, whether people are receiving communications can be looked at, evaluating the effectiveness, evaluating the effectiveness of HARS actions in reducing illness and death from extreme heat events remains challenging. And that was a frequent theme raised during our informant interviews. Real-time surveillance data is valuable focused responses and evaluation, but the rarity of extreme heat events kind of complicates the evaluation of interventions. So initially, a solution could be to share indicator data among partners to improve evaluation efforts. And this was a great quote. I think it would be great for us to do more systematic evaluation, but I also struggle with being confident that that would tell us whether we're succeeding or not. So just to go over some limitations of our review is really a snapshot of what is happening based on a small subset of respondents across the country and also our web searches. So we had a low response rate for surveys and we didn't interview everybody. So I think it's also that's also sort of the other limitation is that many plans are not public that we couldn't review. We also didn't review local government and municipal plans and collaboration initiatives. And we know that there's been updates to many web pages and new plans are in development. So, and to try and fit everything on one slide for key takeaways. So just to summarize by saying we've found 6 PT government level HARS. And we found also in our web searches other publicly available health authority heat response plans in Ontario and Quebec. And we know there are additional plans that are not public. The challenges faced by key informants in developing HARS framework and HARS plans can be summarized by funding shortages and staff turnover, unclear roles and responsibilities, limited data on at-risk groups, language access challenges, and alert fatigue. Challenges are also elevated in rural, remote, and Indigenous contexts. So some solutions include, oh, I see I'm right there. I should move myself. Securing dedicated funding and clarifying roles, governance roles, fostering collaboration and data sharing across sectors, developing guidance for multi-hazard events, promoting cooling strategies, temperature bylaws, and passive design, and supporting community cohesion models, check-ins, and social networks, etc. Just one aside, we are currently looking at developing a emergency preparedness and response community practice. So that might be something that's coming along soon that may be able to help with the sharing piece of these solutions. Okay, so I think it'd be really great to learn from you about what you think. I just need to open up. Let's see if I can get this going. So if anyone has any ideas about what you think we should be doing to improve the development and implementation of HARS frameworks in Canada, I'm just going to open this up right now. It takes a while on Slido. And this could be anything that's already been said or that we have not covered at all. So if anyone has any things to add here, we really would greatly appreciate. Excellent. Yeah, evaluating interventions for effectiveness, more outreach. There's still some participants, community engagement, absolutely. More clear evaluation criteria, yep. Develop evaluation indicators, yes, and hopefully share. Okay, we've still got some people typing, so we're gonna let this play out a bit more. Oh, great. Wow. Okay. Experts, tools, health. Yeah. More clear evaluation criteria, definitely. Accessing feasibility of right to cooling bylaws. Absolutely. Outreach is really strong, coming up here strongly now. Pools, parks. Okay, there's a collection of words. They may have been part of a sentence. I'm not sure, but we'll see if we can figure that out. A greater emphasis on cooling at home. Building a smartphone application for vulnerable populations. I like it. Okay. Okay, we have one participant typing. I'm going to move on. And I'm not. I'm going to wait. Yeah. Okay. We'll definitely take all this information provided and try and distill it down to some key pieces. Okay. So there's one other thing I wanted to talk about, and that's as you probably know, checking in on neighbors and family during extreme heat is very important. The NCCEH developed this tool a couple years ago for health checks during extreme heat. Check my speakers on. And this is the QR code for accessing that. I think we have time to do this. We might actually, I think I'm gonna skip past because we want to have time for questions, but we were wondering whether or not you're aware of our tool or not. But it doesn't matter because actually, we now like to present a new video highlighting the tool that we developed over the last couple of months. And we hope you enjoy it. And you can give some feedback in the evaluation survey on this webinar. So see if my technology actually works here. It's possible the audio will be terrible because of the bandwidth with the number of people attending. So we'll see what happens. This is a 90-second video.
Friends, family, and neighbors during a heat wave can be life-saving. When it gets very hot, it's important to think about people at risk, especially if they live alone or do not have air conditioning. Sustained indoor heat can be deadly, especially overnight. Older adults, people living with disabilities, and those with conditions like heart disease, lung disease, or mental illness may need extra support. That's why the NCCEH created the Extreme Heat Health Check tool, a simple guide to help you check in on others, in person or remotely. It shows you how to spot signs of heat illness and suggests what steps to take. That might include moving someone to a cooler space, using wet cloths or ice packs to cool them down, or calling 911 if needed. The tool also helps you assess the home environment. Indoor temperatures over 26 Celsius can be risky, and over 31 Celsius can be dangerous. Fans are not enough to keep susceptible people safe. Health checks should be done twice a day during extreme heat. If you can't visit, check in by phone or video chat instead. Together, we can help protect our communities. Visit ncceh.ca to get your copy of the Heat Health Check tool.
Okay, great. Oops. Don't want to start it again. Thank you so much for listening to that, taking the time. Just want to point out that we now have a banner on our website that points to our extreme heat and wildfire smoke resources. So please visit us there to get those, one of which obviously is the video, this report that I've just presented on, and some other resources, recent and longstanding. So thank you so much.